of your paycheck is likely to go towards your health insurance premiums next year.
Across the United States, families are opening their health insurance renewal letters and seeing numbers they simply can't believe. This isn't an isolated case. In Illinois, health insurance premiums for Affordable Care Act plans are set to rise an average of 50 to 60% in 2026, with some insurers spiking rates as high as 78%. Let that sink in. Nearly double the cost to stay covered, and millions are affected. The Affordable Care Act marketplace was meant to make health coverage accessible and predictable. For a while, it worked. But in 2025, a perfect storm hit. Medical inflation outpaced general inflation. Federal subsidies became less generous. Insurers, facing higher costs, filed steep rate increases. In Illinois, the average benchmark silver plan will rise by over 53% in 2026, according to filings reviewed by Crane's Chicago Business. One major insurer, Celtic Insurance Company, raised premiums a jaw-dropping 78%. That's not a typo. Even Blue Cross and Blue Shield of Illinois, the state's largest marketplace provider, raised rates by 11.6% on average. For the 344,000 Illinoisans enrolled in ACA marketplace plans, the shock is real. And while many qualify for federal tax credits, those credits are shrinking as temporary pandemic-era enhancements expire. Those most affected? Working-class families who earn too much for Medicaid, but not enough to absorb a $200 plus per month hike. Freelancers, small business owners, gig workers, people who rely on the ACA for all their health needs. Young adults who are often priced out of gold or even silver tier plans. And for some, the consequence is clear: going uninsured. Illinois saw this coming, and they made a bold move. In 2023, the state broke away from healthcare.gov and launched its own platform, Get Covered Illinois. Key benefits include state-run support lines, available in over 250 languages, a special enrollment period for pregnancy, not available on the federal marketplace, easy enrollment, which lets people opt into coverage when filing state taxes. It's smart, accessible, and it might help thousands avoid losing coverage in 2026. But it doesn't solve the core problem. Prices are still rising. What happens when coverage becomes unaffordable? People delay doctor visits, skip medications, ignore chronic conditions. The results? Emergency rooms overflow, medical debt explodes, long-term public health declines. Medical debt is already the #1 cause of bankruptcy in the U.S. In 2023, over 100 million Americans had some form of medical debt on record. Without insurance, a single hospital stay for appendicitis or a broken leg can cost $15,000 to $40,000 out of pocket. And in Illinois, with premiums ballooning and subsidies thinning, that's a reality some are now forced to face. Open enrollment in Illinois begins November 1st, 2025 for 2026 coverage. Whether you're a current ACA enrollee, recently uninsured, or just shopping for options, this window is critical. You might qualify for new subsidies based on your 2025 income, a more affordable metal tier, a special enrollment exception like pregnancy or job loss, and for those losing Medicaid coverage due to redetermination, you may be eligible for subsidized private coverage. What's happening in Illinois is a warning sign. When premiums rise faster than inflation, faster than wages, the system begins to buckle. Illinois isn't alone. States like Georgia, Texas, and North Carolina are also seeing double-digit increases. But Illinois is unique because it's the first to try reclaiming control with its own ACA platform. And 2026 is its stress test. Will it keep people covered? Or will thousands fall through the cracks? This is more than an insurance story. It's a story about access, about choice, and about survival in a system where your zip code, your income, and your timing can decide whether you stay healthy or go bankrupt trying.